Hello again. Thank you. I think we will begin. I think we've settled down a little bit here in people entering the virtual room. Welcome and thank you so much for joining us today. My name is Jeff Drope from the Bloomberg School of Public Health at Johns Hopkins University. I'm joined today by my colleagues Anita Bontu, Saw Min Thu Oo, and Carlos Guerrero from our team, the Economics for Health, as well as Margaret Dorokina, who you can't see in the black box there. She's the one working things behind the scene. I'd also like to warmly welcome our discussant today, Céline Colin from the Organization for Economic Cooperation and Development in Paris. Thank you so much, Céline, for joining us. We're so grateful to have you here and delighted to have you here. Next slide, please. Before we jump into presenting the results from the fourth edition of the Cigarette Tax Scorecard, I want to thank a number of people. First, I want to thank our other co-authors who are not on the call but are hopefully watching here today, listed there. A very special shout out to Professor Frank Chaluka, who had the original idea to develop the scorecard 6 years ago. It was a genuine honor to help Frank bring that to fruition the very first time, and it is just as much a pleasure for our team to bring it to you now for this fourth edition, biennial edition. Again, I'd like to thank Céline for coming. I'd like to thank Margaret for all of the background work that she's been doing on communications, logistics, helping with all of the organization of the design of the new scorecard, which you can now all find online. I'd like to thank Carlos for agreeing to come on. He's going to be the person working the question and answer. So if you have questions and answers, please go ahead and put them in the Q&A. I want to also mention that we have simultaneous translation into Spanish today. So if you haven't found it yet, there's a little globe at the bottom. Just click on the globe and you can get our interpreter. So I'd like to thank Christiani for being our interpreter today. Next slide, please. Oh, sorry. Before I get there, I want to actually have one other huge shout out, and that is to our colleagues at the WHO tax team in Geneva. They are the folks that really collect the lion's share of the tax data that we use to develop the scorecard. They really do an amazing job. It is a thankless and brutal task. So we're grateful that we don't have to do it, and we're grateful that they do it, and then how sharing they are with the data and supportive of the tax scorecard in general. So we really have a huge shout out to them. And I should also thank our external reviewers. We've had this scorecard reviewed many times over the last number of years. As recently as last week, we actually had more feedback from our colleagues at the Universidad Adolfo Ibáñez, wonderful colleagues who gave us some really new, great ideas. I have to admit, we're probably not going to incorporate them this time, but we will be thinking about it for next time. And as well, we will be actually releasing in Q1 of 2026, an alcohol tax scorecard. So please look forward to that. And it was really great to get that input from them on that as well. Now I can go to the next slide, Margaret. Thank you. I think we need to always ask the question, why are we here? Probably knowing this audience that tends to come to these types of webinars, I may be preaching to the choir here, which is okay, but hopefully we also have some newer folks who haven't thought as much about tobacco taxation. So regardless, I think it's never a bad idea to go back to first principles. I think the first thing we can consider is about a billion people still smoke, which is a remarkable number of people. And half or more of those people will die of a tobacco attributable disease. And smoking, on average, takes 11 years off of your life. Perhaps, I don't want to say worse than that because that's pretty awful, but to add to that, smoking use exacerbates inequities. In most countries, people from lower socioeconomic groups are more likely to use tobacco and therefore to suffer more from the negative health and economic effects. However, we know that raising excise taxes on tobacco products is the single most effective and cost-effective tool we have at our disposal to drive down consumption. If you raise the tax, companies are going to raise the price because they have to maintain their profits ultimately, and people will consume less. This means that young people will not start, people who smoke will quit, and others will reduce their consumption. Thereby, this will save lives, save billions in healthcare costs, enhance economic economic productivity because we know that non-smoking populations are much healthier and much more economically productive. And of course, because these products are inelastic, even as the consumption goes down, tax revenues generally continue to go up. And these new revenues can be allocated towards policies that enhance prosperity, including especially health and education. And I also want to make a very important point that overall, at a population level, health taxes, including tobacco taxes, tend to be really wildly progressive in that people in lower socioeconomic groups and young people are more sensitive to price, so more likely to quit or consume less or not start, and therefore they reap far greater, disproportionately more benefits from the effects of taxing tobacco products. So that is why we are here. Again, probably don't need to tell most of you here that, but I still think worth us thinking about why we put all of this work into the scorecard to bring this to you every 2 years. Next slide, please. There are 4 components to the scorecard, and I'm going to hand off the mic in a few minutes to my colleagues Anita and Saw Min, but we are going to talk about cigarette prices, changes in cigarette affordability over time, because we know that it's more than just price, but also there is an income effect here, but you'll hear more about that in a moment. The share of taxes in the retail cigarette price has typically been the indicator that we've used through the last couple of decades. It's a wonderful indicator. It's not perfect, which is probably one of the biggest reasons it drove us to actually developing the scorecard in the first place. And again, you'll hear more about that in a few minutes. And then, of course, the cigarette tax structure matters a whole lot. If you build a good structure, it will ultimately work well, and you will start to reap the benefits for health and the economy. Next slide, please. We use data, as I said, from the WHO. They have their wonderful biennial report on the global tobacco epidemic, and they have a wonderful section on taxation, which is very, very comprehensive. We are able, through the use of all of those reports, as well as augmenting it with other data from the World Bank and the IMF, we're able to develop the indicators that you're going to hear about in a moment. And we're able to develop scores right back to 2014 every 2 years. So we now have a nice 10-year period to look at the change in cigarette tax scores over time. As I said, also, we've subjected this to extensive peer review over the years, and then it is, of course, based on recommendations and guidance and experience from multiple sources, including the WHO's wonderful tax manual, several seminal works from the World Bank, as well as publications from the IMF and the OECD, among others. So we really are building on a really rich history of research, and we continue as new research comes in to reconsider the scorecard each time. Next slide. I'll start with the overall score. So next slide, please. It is actually 2.01 out of 5, and you can see here in this heat map, darker green means higher up towards 5, so it's a 0 to 5 scale. 0 is very bad, 5 is very good, and what we see here is an awful lot of light green, and that is very worrisome. So we can see that on average, countries have almost 3 points that they can still get. So we'd like to think of this optimistically and look at it as an enormous opportunity for change. We have a lot of opportunity for governments to fix their tax structures, to raise their tax rates, and to get this. I'd love one day to pull up this map and it be all dark green. So that is our goal as a collective working on cigarette taxes. Next slide, please. This is just a way of looking at it in comparison. We have in red there the global score, 2.01 out of 5. And then to the right of that, in the purple bars, we have the WHO regions, and you can see tremendous variation there. The European region does the best at 2.7 out of 5. It is driven, excuse me, in quite large part by the European tobacco tax, the EU, tobacco tax directive, which has set really over the years a pretty ambitious benchmark. I want to also mention that it is under renegotiation right now, and I can tell you there's a lot at stake here. And I really hope that our European colleagues listening today will take this very seriously. I think that it not only drives taxes in the European Union, but in the other countries in the European region, and even globally because other countries look to it as an example of good practices. All that said, at 2.7, you can still see that the European region still has plenty of room to improve, and we'll explore that in a little bit. But we can also see that we have some regions struggling. Africa, Eastern Mediterranean, well below the two benchmark. So we really have tremendous opportunity in those regions to improve. Over on the far right, we have it broken down by World Bank country income groups. And you can see a pretty obvious pattern here that the higher income countries do better and the lower income countries are on average doing worse. And we see a tremendous variation there between 1.12 up to 2.5 or 2.6. So really tremendous variation. And again, very worrisome because we know also that the tobacco industry is expanding in those lower income markets these days, where typically in a lot of those countries we had very low prevalence, but this is changing quickly. And I think we have a lot of work to do to raise taxes and improve tax structures in many of those countries. Next slide, please. Here are our top performing countries in the two left sets of columns. We have the United Kingdom, the UK, and Finland, both scoring 4 or higher. The only two countries, in fact, scoring 4 or higher in this version of the Cigarette Tax Scorecard. Congratulations to them. We see that they do very well on price. They both have very high prices. They do quite well in tax share. Still a little bit of space to improve on tax structure. And then affordability is a 3 out of 5, which we'll see in a moment is a relatively good score relative to other countries. But again, we could see that other countries are scoring 5 out of 5 on change in affordability. So we can see that there are still opportunities, even in our high performing countries. And we can see that the comparison to the global scores, the component scores, and the overall score to the right, and then the other high income countries similar to Finland and the UK. Next slide, please. I am now going to hand the mic over to my colleague Anita Bontu to talk about two of the score components. Anita.
Thank you, Jeff. Hello, everyone. Thank you for joining. The first component that I will discuss is price. Next slide, please. Why is cigarette price important? So, of course, cigarette price is the variable that we are interested in and one that also affects smoking behavior. Generally speaking, higher prices reduce cigarette consumption. However, cigarettes, given that they are relatively price inelastic, when we produce an increase in price will result in a less than proportional decline in consumption. So, large price increases are necessary to affect consumption. Inelastic means that consumption does go down, but as Jeff mentioned, tax revenues do generally go up. Even when tax structure and tax share of price are ideal, tax systems will not be optimally effective in discouraging consumption if prices remain low. Next slide, please. About half of price-related declines in consumptions can be attributed to reduced smoking participation, which means either quitting or not starting, and the remaining decline is due to reduced smoking intensity among those who continue to smoke. Youth are 2 to 3 times more responsive to tobacco price increases than the general population, likely due to their limited income, lower addiction levels, and other peer effects. Evidence from both higher and lower income countries shows that lower socioeconomic groups are more responsive to price changes than higher socioeconomic groups. Therefore, people in lower socioeconomic groups tend to benefit more from price-related reductions in smoking, thereby improving their health and economic equity. As we mentioned, at a population level, tobacco taxation is very progressive. Next slide, please. For the cigarette price component, the scores of 0 to 5 are assigned as follows based on the price of a 20 cigarette pack of the most sold brand in international dollars, adjusted for purchasing power parity. This component is based on 2018 prices in international dollars. A score of 5 is assigned to countries with a price of 10 international dollars or more, and a score of 0 is assigned to countries with the price of less than 2 international dollars. Next slide, please. So for the 2024 scores, among those countries with available data, only 24 countries received the highest score of 5, up from 21 countries in 2022. 16 countries received a score of 0 in this component for this year's scorecard. Next slide, please. Looking at changes in the score over time, price scores have mostly risen. The overall average price score slightly increased from 2.38 to 2.45 in this year's scorecard, and over the 10 years of our analysis, 8 countries have experienced more than a 2-point increase, whereas 25 countries have seen a 0 to 1 point decline, and 1 country experienced a decline of 1 to 2 points. Next slide, please. Looking at this by WHO region over the last 10 years, from 2014 to 2024, average cigarette price scores generally rose across all regions. In 2024, the average cigarette prices were highest in the Southeast Asia, European, and Western Pacific regions, and the lowest prices were found in the African region, which is what we saw in 2022 as well. Next slide, please. Looking at this by World Bank country income group, average cigarette price scores rise with country income. Notably, average cigarette prices in low-income countries decreased around 10% from 2022 to 2024, raising concerns that inexpensive cigarettes are becoming even more accessible to young people in these places. Next slide, please. The next scorecard component that I'll be discussing is affordability. Next slide, please. Affordability change is another key variable that affects smoking behavior. Cigarette consumption typically increases when prices decrease, and increases in income often result in greater consumption. Cigarette affordability addresses both of these factors, price and income, by reflecting an individual's ability to purchase cigarettes. In recent decades, many low and middle income countries have seen rapid growth in income and inflation, and these increases in inflation and purchasing power can deteriorate the impacts that tax and price increases have on consumption. Next slide, please. The change in affordability score assesses changes in cigarette affordability over a 6-year period, for us 2018 to 2024. Affordability is defined as the percentage of per capita GDP required to purchase 2,000 cigarettes of the most sold brand. So an increase in this measure implies that cigarettes are becoming less affordable over time. The scores for this component are assigned 0 to 5 as follows, with 5 assigned to those countries with 7.5% average annual change or higher, and 0 assigned to those countries with either increased affordability or no statistically significant change in affordability. Next slide, please. So for the 2024 scores, among the 186 countries with available data, only 5 countries received the highest score of 5 in 2024, down from 11 countries in 2022. A large majority of countries, 164 of the 186, received a score of 0. Most countries received a score of 0 because either affordability increased or their change in affordability was not statistically significant. We discuss further reasons for this in the full scorecard report, which is now available on economicsforhealth.org. Next slide, please. Again, looking at change in country scores over time, cigarette affordability scores have been very volatile. The 2014 global average score was 1.14, and this went down to 0.39 in 2024. Over the past 10 years, 10 countries experienced a more than 2-point increase, but 37 countries saw a 2-point or greater decline. Next slide, please. Looking at this by WHO region, the African, Eastern Mediterranean, and Western Pacific regions experienced declines in average score, and the European and Southeast Asia region saw a slight increase in 2024. The Eastern Mediterranean region experienced the best average annual percentage change over the 6-year period, with an average annual decline of 3.47%. We'd like to note that in the EMRA region, cigarette prices likely increased due to industry-led changes rather than tax change, and despite this, cigarettes remain very cheap in this region. Next slide, please. And again, by World Bank income group, lower middle income countries scored highest on the change in affordability at a score of 0.55 in 2024, followed by low-income countries, and the high-income group has experienced a large drop from 2020's average of 3.21% average annual change to negative 1.35% in 2024. This shows that cigarettes are becoming more affordable in this country group on average. Next slide, please. And I'd like to hand it over to my colleague, Saw Min.
Thank you, Anita. Hello, everyone. Thank you for being with us today. I will be covering the final two components of the scorecard, tax share and tax structure components. So let's start with the tax share component. Next slide, please. To assess the tax share component, there are two common benchmarks of the tobacco tax performance. The first one is the total tax share, which is the sum of all taxes expressed in percentage of the retail price. WHO currently recommends that the total tax share is greater than 75% of the average retail price of the tobacco product. The second benchmark is the excise tax share, as derived from the 2010 WHO Technical Manuals on Tobacco Tax Administration. The benchmark assesses whether the excise tax share is at least 70% of the retail prices of the tobacco product. Excise taxes are particularly useful to increase the price of the cigarettes relative to other products. Next slide, please. Tax share in retail price is critical tax performance measure. Generally, higher tax share result in higher retail prices. This subsequently reduces the tobacco consumption and generates greater government revenue. When taxes are increased to the recommended level, prices increase significantly, which motivate users to quit and prevent youth from initiating tobacco use. Next slide, please. This slide explains the scoring rubric. The final tax share score is the average of the score assigned to two benchmarks, total tax share and excise tax share. For total tax share, we assign the measurement score of 5 when the tax share is 75% or higher of the retail price. For excise tax share, the score of 5 is assigned when the tax share is 70% or higher of the retail price. Then, the score declines incrementally based on the percentage bands presented on the slide. Next slide, please. The map illustrates the tax share score by countries across the globe for 2024. Only one country out of 185 countries with available data received the highest score of 5, meaning it achieved score 5 in both total tax share and excise tax share. An additional 38 countries received the highest score of 5 only for their total tax share, but not for their excise tax. On the other end of the spectrum, 39 countries scored 0 for both total tax share and excise tax share. Next slide, please. This map shows the changes in tax share scores of countries between 2014 and 2024. We found that the improvement in tax share score was modest over the decade. The global scores rose from 1.92 in 2014 to 2.15 in 2024. Overall, the tax share score increased in 73 countries, with 11 countries experiencing more than 2-point increase. However, the scores fell in 37 countries between 2014 and 2024. Next slide, please. This figure compares the average tax share scores from 2014 to 2024 globally and by WHO regions. Tax share scores are highest in the European region. In contrast, they are lowest in the African region. The Southeast Asia region experienced the highest average gains in both total and excise tax share from 2022 to 2024. However, both tax shares decreased in the Eastern Mediterranean and European region in 2024. Next slide, please. When we analyze the tax share scores by World Bank income group, we observe that the scores rise with country income, depicting the same pattern as the cigarette price scores. The average tax score is nearly 3 times in 3 times higher in the high income group than the low incomes group. Next slide, please. Let's continue to the final component, the tax structure. Next slide, please. There are 2 types of excise taxes typically levied on the tobacco product. They are either specific or ad valorem. Specific taxes are assessed per unit of the product. For example, a fixed tax amount per a pack of cigarettes. Ad valorem excise taxes are assessed as a percentage of the value. For example, based on manufacturer price or retail price. There is also a hybrid type where both ad valorem and specific taxes are levied. There is another tax system called tier tax. In the tiered system, different levels of tax are set depending on the product features, such as the length of the cigarettes or the packed price category. Next slide, please. Tax structure components is important because it greatly influences the cigarette's price. It critically affects the variations of the cigarette price in the market. The greater variability in the price creates more opportunity for smokers to switch to cheaper brands as a response to tax and price increases. This happens instead of quitting or cutting back on consumption. An important point here is that specific taxes are shown to be more effective in raising consumer prices compared to ad valorem taxes. This results in greater reductions in cigarette smoking. Furthermore, the complexity of the tax structure and their ease of administrations impact the effectiveness of the tax systems and revenue generation. Specific taxes are easier to administer. Next slide, please. As discussed previous slides, specific taxes generally result in greater reductions in cigarette consumption. Complicated tax structures such as tiered tax systems and systems with a greater share of ad valorem in hybrid structure are associated with higher cigarette consumption compared to tax structure that rely more or entirely on uniform specific tax structures. Next slide, please. The scoring rubric for tax structure is qualitative compared to 3 other components. The measurement score of 5 goes to the countries which implement a uniform specific tax with automatic adjustment for inflation or other factors. The measurement score 5 is also assigned to a uniform mix system with greater share of specific tax with automatic adjustment for specific component. The retail price of the base for ad valorem component and a minimum specific tax. The score of 4 is assigned when the country implements a uniform specific tax or uniform mix system with a greater reliance on specific tax but lacking other features. The score 3 is reserved for the countries with uniform mixed system with a greater share of ad valorem tax. A uniform ad valorem tax and a tier specific or ad valorem excise taxes are categorized as the score 2 and 1 respectively. Finally, the minimum score 0 is assigned to countries with no excise tax. Next slide, please. The map demonstrates the tax structures score by countries in 2024. 21 countries out of 185 with the available data received the highest score of 5. Most countries receiving the score of 5 implement a uniform specific excise tax automatically adjusted for inflation. Next slide, please. Between 2014 and 2024, the tax structure score have improved on average, rising globally from 2.46 in 2014 to 2.95 in 2024. However, the modest increase from 2002 global average of 2.92 indicates that the most countries have not changed their tax structures in the last 2 years. From 2014 to 2024, 51 countries experienced improvement in their tax structure score. tax structure score, while 13 countries saw a decrease. Next slide, please. The graph comparing tax structures scores across WHO regions show that from 2014 to 2024, the African region achieved the largest gains in tax structure score, increasing by 0.69 point. However, during the 10-year period, only the Southeast Asia region saw no change, with the average score staying at 1.3. Next slide, please. When we look at the score by World Bank income group, the high income group continued to score highest on average, while all country income groups show increases in their tax structure score over the 10-year period. The low-income countries show the largest gains. Notably, the low-income group average is higher than the lower middle group in recent 2-year period, 2022 and 2024. This is the end of the analysis of the 4 components. I will hand the presentation back to Jeff for the conclusion and recommendations.
Thanks so much, Saw Min and Anita. That was a really great set of descriptions and explanations of a number of very complex component scores. So I hope that everybody has a better idea of what undergirds the overall score that I talked about initially. I'm going to begin with some reflections. Next slide, please. Let me just recap a little bit what Anita and Saw Min have been describing here. I'll start with cigarette prices. As Anita said, what we are seeing is actually that the average cigarette prices increased across all regions. It's pretty interesting to us because in the 3rd edition, we actually saw the exact opposite trend, where we saw actually declines in price in almost every region. So this was very, very interesting to us when we did these calculations. However, I really have to note that the prices did not go up enough, as you can see in the change in affordability score, to actually change affordability. But I do want to note another really important dynamic here, and that is that most of the price increases that we saw in countries did not come from tax increases, unfortunately. Instead, they came from industry pricing, which suggests a lot of things. One of which is the industry thinks it's okay to raise prices, and they're happy to get those extra profits. So that's one thing. The other is there is just a tremendous amount of room here to raise prices, to raise taxes and then lead to higher prices. So this is really a big problem. Cigarette prices are simply too low, and it is affecting public health outcomes for sure. As we saw in the change in affordability, we only have 11% of countries in the entire world who are achieving the goal of a less affordable cigarette. And this is really, again, problematic and speaks to again, very low tax rates and in many cases, problematic tax structures. In many countries that we saw, and if you go into the actual report itself, we break down the 0 scores because it actually represents a number of different things. And you can see that a lot of countries, in fact, that cigarettes are becoming more affordable, which is really, really problematic in terms of young people, especially starting to smoke. Again, goes back to this basic fact that governments are not raising tax rates quickly enough or high enough. Tax share. We've always believed it's a reliable indicator of cigarette excise tax performance, but problematic in some cases. And the cases where it's problematic typically is where you have very low prices, because you can have a tax share that is deceivingly high, and countries are actually lulled into a false sense of security when in fact prices are still too low, and it's to prices that consumers react, not to taxes. So it's really important that tax shares be high, of course, but we want it driving up prices to be high here as well. And we are falling below the WH benchmarks in most countries. So again, tremendous opportunity for improvement. The last component, as we saw from Saw Min, in the last part here is that we have some challenges still in dozens of countries. First, we have 16 countries without an excise tax on cigarettes, which is quite appalling. We still have several dozen countries with tiered structures. We know those tiered structures are highly problematic because it really creates opportunities for very cheap products to continue to exist. And what we know is that some consumers, when the prices go up of their brand, will search for a lower price brand. So what we want to do is we want to push all prices upwards, and we can't do that very effectively with tiered structures. We still have some countries using ad valorem only systems. We know these are not very effective because when you have very low priced products and even if you add on a very high ad valorem tax, it's just not going to drive up the price like you could with a sizable specific tax. And then we still have, again, many countries who have implemented the uniform specific tax as is best practice, but then have no adjustments. And when you have a specific tax that doesn't change, inflation and real income growth erode those taxes very, very quickly, and the effects of them disappear quite fast. Next slide. So our recommendations. Well, obviously, we need to implement regular high tax increases that outpace the combination of inflation and real income growth. We want to increase the price of cigarettes to make them less affordable. We need to simplify all of these complex tax structures, both because it's easier to administer and because it decreases the risk of tax avoidance, substitution, as well as tax evasion or illicit trade, if you will. We want to ensure that cigarette tax policies cover products regardless of characteristic. And, we see them all over the world, not covering cigarettes uniformly, including by brand or by price point. So we have some fundamental problems in terms of the lack of consistency in cigarette tax policies. I might also put in a word here about non-cigarette tobacco products. They should also be taxed appropriately. This is a little more of a complex discussion that I'm not going to get into today. I'm sure we will have future webinars about this. But we have to understand that every tobacco product pretty much these days is extremely harmful. In the case of electronic cigarettes, for example, they're being marketed to kids and they're heightening youth initiation in many countries. And this is really problematic. So we really need to think about taxing all products. We would like to have a tax scorecard for all tobacco products. We just don't have the data. And we get asked about this every time. Every 2 years we look and think, are there enough data this year to do it? And the answer so far has been no, but it's definitely on our radar. We are well aware of all these other tobacco products that exist and worry about them, and we do monitor them, but we just can't do it with the same rigor that we do the cigarette tax scorecard. So if we do all of those things, what are we going to do? Well, we're going to protect our population overall, and then our most vulnerable populations, especially young people and people in lower socioeconomic groups. As I said, these folks are more sensitive to increases in cigarette prices. We're going to prevent the expansion of cigarette markets. As I said before, we have several regions, especially Africa and the Eastern Mediterranean, where we're seeing very large increases in the size of these markets. Typically, many of these countries had very low prevalence, and now we're seeing prevalence grow. And we know the tobacco industry is working hard to grow their markets, and we know that cigarette excise taxes will prevent this. All of this is going to improve population health by preventing tobacco-attributable disease and death, and all of the costs that I talked about earlier, and the costs to people and their families, as well as to the overall economy of every country. And then, generally speaking, as I said, it will increase government revenues that can then be reallocated towards the priorities of governments, which we hope will be all prosperity enhancing. I'm going to stop there, and I'm going to hand the mic to our esteemed colleague, Céline Colin from the OECD. And Céline, we'd love to hear your impressions.
Thank you, Jeff. Thank you, colleagues. Good morning, good afternoon, good evening, everyone. And thank you very much for having the OECD Center for Tax Policy and Administration in this event. As many of you know, at the OECD, we support countries by providing public policy advice, by benchmarking their performance against one another and against international best practices. And over the past years, we have worked on tobacco taxation, and the Cigarette Tax Scorecard is a very powerful tool that we regularly use in our work. First, because it allows to assess where countries stand in terms of cigarette tax policy. But second, because it clearly highlights the areas where a country is falling behind in terms of cigarette tax policy design. And this is precisely the type of information we need to initiate a constructive dialogue with governments and especially with ministries of finance, because to have that conversation, you must be able to show to a country where it stands relative to its peers within its region or against global best practices. So the fourth edition of the Cigarette Tax Scorecard brings interesting insights. And let me repeat in a very condensed way what has been said so far by colleagues. So globally, the average tax score has not improved since 2022 and progress has stalled. As Jeff said, the average cigarette price have gone up, which is positive, but in some cases, the increase is driven by industry pricing strategy rather than tax policy. Where governments have increased taxes, the increase are often too modest to keep pace with inflation and real income growth. In many countries, cigarettes have become more affordable or their affordability has not changed. And finally, as a result, nearly 7 billion people live in countries where tobacco taxes are not being used to their full potential. So from that, the conclusion is pretty straightforward. Countries need to do more to reduce tobacco use, and tobacco taxes are a powerful tool that they have and that they should use more effectively. How? Well, by increasing their levels or by improving their design. And this is what the report shows very clearly. We know, and the report has shown very well, that some countries have made efforts to improve on the design and of their tobacco taxes, and we truly recognize and support those efforts. But for those countries, the challenge now and in the years ahead is that tobacco taxation cannot be treated as a one-off reform. So they will need to continue their efforts. They will need to continue improving the design and increasing their taxes on tobacco. Why? Because the tobacco market evolves rapidly, as Jeff has mentioned before, and also because the macroeconomic conditions also evolve. The report highlights several success stories which have, very high scores for cigarette taxation, and that shows that reform is possible. And those examples bring lessons and experience to other countries. The report touches upon lots of interesting topics within cigarette tax policy, and I really strongly encourage you all to read that document. It's short, well written, to the point. It's a very pleasant read. And in the few minutes I have left, I'll just focus on a couple of key points that are included in that document. Let me start with tobacco tax policy enforcement. Having a tobacco tax system that looks good on paper, that checks all the best practices principle, is not the same as enforcing it properly. And too often we observe that there is a gap and a disconnect between tax policy design and implementation. And in practice, that means that even the most carefully designed tobacco tax policy can fail if not well enforced. The second interesting point is prices. Final retail prices of cigarettes and other tobacco products are essential information. And ideally, countries should be able to track prices over time across brands and market segments. And why? Why? Because that data allows them to analyze the impact of tax increases, to understand industry pricing strategies, to calculate average prices, and to assess price dispersion. And all of those elements are critical if you want to evaluate the effectiveness of a tobacco tax policy. For sure, under mixed systems where there is an ad valorem component, but also within specific only tax system. Why? Because countries and policymakers need to be aware of prices to be able to ensure that the specific tax is high enough. And yet, surprisingly, this basic information is often incomplete. And that's what the report says. Even collecting price data in a systematic manner across countries and over time is a challenge. So we really think that countries should invest in robust price reporting and monitoring system, not only for cigarettes, but also for other tobacco and nicotine products. And that brings me to my third point. We all know that cigarettes remain the most widely consumed product globally, but countries cannot afford to overlook the rapid trend and the rapid rise of new tobacco and nicotine products such as HTP, e-cigarettes, nicotine pouches, and others. The market is evolving very rapidly, and they need to be prepared to tax those products in an efficient manner and at sufficiently high levels. Why? Again, to prevent a new wave of addiction, of tobacco and nicotine addiction, especially among youth. Let me conclude by turning to the topic of revenue. The report notes that many governments are still not using tobacco taxation as a public health tool, but see it rather as a revenue tool. And this is very much in line with what we also observe here at the OECD. And what's striking is that many countries lack even a basic overview or consolidated picture of the revenue they raise from tobacco. For instance, how much comes from cigarette versus other products, how much comes from excise versus the VAT, and how that has evolved over time. But even more striking is a finding that is, holds across all the countries with which we have worked, is that the economic and social costs of smoking exceed the revenue from tobacco taxes. And so from a pure budgetary perspective, the conclusion is clear. A society that smokes is simply not financially sustainable. Let me conclude by a positive trend that we observe in the report, is that in 2024, more countries, more governments undertook tobacco tax reform than in 2022. And that means that number one, tobacco tax reform is achievable, and country can take steps when there is political will. The second is that the importance of tobacco taxation is increasingly recognized as a tool for health and revenue financing. And three is that there is real momentum and hope that even more countries will advance and make progress on tobacco tax reform in the years ahead. So let me stop here. Congratulations for this extremely useful and interesting work. We use it. We will continue to use it. So thank you very much. Well done.
Thank you so much, Céline. And we knew maybe you would have a slightly biased view when we invited you, but nevertheless, we really appreciate the comments and the positive support here. And I think you're right that this all comes down to political will. I think that the research is unequivocal. It's enshrined in international law in the form of the Framework Convention on Tobacco Control. Article 6 actually covers tobacco taxes specifically. There are wonderful guidelines that go with it. So this is not new. This has been, several decades. But I'm going to go with your last optimistic point, Céline. And we did see more countries making moves towards better taxation. I don't think it's, fully reflected, if you will, in the scores yet, but I have some optimism that it will be over time. We unfortunately see some countries going backwards remarkably. We saw some countries introducing tiered structures in the last few years, which is absolutely appalling. So we definitely have our work to do, but it is wonderful to have the partnership of organizations like yours and the WHO and the World Bank and the FCTC Secretariat. And it really is a group effort here. I'm now going to ask Carlos, who has been very dutifully working very hard in the Q&A box, I can see. Carlos, do you have a couple or three questions? And I will say, we won't get to all the questions here today, but we are going to post them in a blog. So we will make sure that we answer all the questions that have been posted. So we will save them. But over to you, Carlos.
Yeah, thank you very much, and thank you all for your very interesting questions. So I have tried to respond some of them, but there are some unresponded that I will ask you to the panelists. First, AFTAF. In Pakistan, we have 3-tier excise duty. and later on reduced onto which is presently applicable. There is a new thinking that only one tier is the remedy, as it will not give leverage to industry to play and tinker with the rates and simultaneously minimize evasion and reduction in illicit trade. The industry every year is propagating that increasing taxes will shift the legal production into illicit trade, which is not true. Any views and thoughts of the experts on this?
I'll jump in here to start. As we've said, these tiered structures are problematic for tobacco control. Period. We know that they provide opportunities for people to substitute down to a cheaper product. We do not see any specific evidence, and we work all over the world in exactly this area, that when countries are actually rationalizing their tax structures and making them more simple, that we get increases in illicit trade. I think that's nonsense propagated by the tobacco companies themselves to try to convince governments that they shouldn't do this. In fact, what we see is typically the opposite, that when you make your system more simple, it actually is easier to administer, and it provides opportunities for you, for example, to put in place measures that can help to secure your supply chain, such as licensing or tracking and tracing systems, and you can actually allocate your time and energy to making sure that you actually mitigate the illicit supply. I don't know if any of my colleagues want to jump in here. All right, next question, Carlos.
Thank you. This is a more methodological question by Estelle Doshi. Would it make sense to weight the overall score by country size or the population of cigarette smokers?
I'll jump in here, and Saw Min, who is actually the brains behind all of these calculations. He is on the forefront of all of those efforts. But the problem with the population weighted averages is that the large countries dwarf the small countries, and we're very mindful that it just creates a very different meaning. So China and India, obviously massive countries if you're throwing them into the same calculations as Palau. So really important to think about what are the implications of a weighted average versus a non-weighted average. I can absolutely see the case for it, Estelle, and perhaps we can include a footnote to show what the weighted averages would look like. But you can especially see it in several of the regions, Western Pacific in particular, where the averages don't mean anything anymore when you use a weighted average. Saw Min, do you want to add anything to that?
Yes, we don't do the country population-based average for the score, as the reason mentioned by Jeff. Yeah, we can see how the score will be changed based on the population base as an experiment in our own analysis, and we will look into that.
Next question, Carlos.
Thank you. This question is by Andrew Black. Articles 6 and 15 of the WHO FCTC are critical to this topic. I wonder if you could say more about how the WHO FCTC can be used to encourage governments to do more on tobacco tax.
Yeah, it's a great question from Andrew. I mean, it is the international treaty that is the foundation of so much of the work being done in the world. I mean, it is law. Countries agree to this when they join the FCTC, that they're going to actually uphold all of these provisions, which includes Article 6, which is about tax, and Article 15, which is about securing the supply chain. I think maybe I look at it a little bit differently, and I think governments should look at the FCTC as their political cover, right? Governments need to be brave, and they need to point to the FCTC and say, hey, look, this is actually the international obligation to which we signed on, and we need to actually fulfill this obligation by improving our tobacco taxes. And again, I want to point to the guidelines. They're very good. They really highlight almost all of this same points that we've made here today. They're a really good building block for countries. So I think too, I'm hoping that in the next COP, we're going to restart the conversation about taxes. We've had a couple of COPs without very much conversation about Article 6. I think it's high time for another really serious conversation. And we can really look to the scorecards over the last couple of editions to see that we should be making faster progress here. So we know we're making faster progress in other areas like smoke-free or on warning labels. But the reason I believe we're not making that quick progress yet on taxes is because tobacco companies fear it and they lobby vigorously against it because it's, I think, an existential threat to their livelihoods. And we know it works. It just absolutely works, which is why they fear it. So we will keep using the FCTC as you know, to back up our work, and we're grateful for it. And we will keep raising our voices in the COP and MOP fora in order to get this conversation really restarted among parties.
Thank you. Maybe we can have a time for another question. This is a merged question because it's on the same issue. It's by Prabhat Jha and Danny McGoldrick. It's about the issue of the foregone government revenue after the industry increases prices beyond the tax increases. So Prabhat asked if we could estimate this foregone government revenue, and Danny McGoldrick asks if the report itself documents that the price increases have been caused more by industry price increases than by tobacco taxes.
Well, we do this quite often at the country level. Our team at Economics for Health, I'm quite sure that Céline and her colleagues at OECD have also engaged in exactly this exercise. We are interested to see what these foregone revenues are, and it's a real thing. By the same token, and actually Anita and I were just working on this in another country recently. Pakistan's done a very good job doing this, and our colleagues in Pakistan at SBDC have talked about actually some of the difficulties that are involved in calculating those foregone revenues. It's not as straightforward as one might think because a lot of variables go into ultimately the policies that are implemented and the revenues that are generated. Nevertheless, we will continue to do this at the country level. Of sadly the time or the data to be able to do it in the scorecard for a very large number of countries. But for the countries that we do have the data and the countries that we're working in, deeply and typically working with finance ministries, we will be exploring exactly this issue. We don't want the tobacco industry to get those revenues. We would like governments to get those revenues through excise taxes. I think that's probably the end of the session today. I want to thank, first of all of you for coming. We really appreciate your time. We really appreciate the support. I see many familiar names on the list here, and we're really grateful. It really is a fantastic community of people working to promote tobacco control and to promote better tobacco taxation. As we know, this stuff works. So we're really excited to share the Cigarette Tax Scorecard with you all. Thank you again, Céline, for joining us from OECD. I thank all of my colleagues at Economics for Health. It's a lot of work putting this together. I'm really grateful for their colleagueship and their just general overall brilliance. It is wonderful to work with them each day. So thank you again, everybody. Please go online. You can now download the full scorecard. We're really always interested in your feedback. You can see our emails there. Please promote widely among your colleagues, and we look forward to seeing you all very soon. Thank you again for joining us.